welcome everybody. At Center for Inclusive Policy, we have these biweekly team meetings where we often invite outside guests to share the research and the work that they've been doing. And we were very excited when the team from Sudan was willing to
Eh,
come to us, and we thought it was
sorry, sorry to interrupt you. South
sure.
Sudan.
South Sudan. I'm sorry, right? The team from
Okay.
South Sudan. Thank you for interrupting me. um, come to us. We thought it was so interesting, and that we decided to open up our meeting to other people interested in inclusive education. So we're happy to have a lot of guests with us this week to talk about moving from invisibility to impact, reforming disability data systems within education management information systems, or EMIS, lessons from South Sudan. And disability, in order to have inclusive education, in order to develop those programs, in order to monitor them and evaluate them, to plan effectively, we need good data. And lessons from South Sudan we're going to learn about their efforts to do exactly that. And so our first guest is it Daniel Gangasaka, the GESS team leader. And we'd ask, welcome to the meeting. And if you can please just give us a short overview on the scope of work that you've been doing and how you've tried to structure the program to ensure that disability inclusion was cross-cutting, and how you attacked the problem of having limited data. I don't know if
I'm
it,
not. I'm not sure he's there. uh,
well, if one of your team
okay.
could
I
then give an
think.
overview of the program and
Yeah.
why disability data was
All
identified as
right.
being an issue, and yeah.
All right. So let me jump in. I was. I'm Marie Schoeman, and I was a disability technical advisor, disability inclusion technical advisor, together with my other colleague Rachel Gondwe. We were the two advisors. And then there was the local team. The project is funded by the FCDO, and it's quite a large scale program. Really, it has oversight over the whole education system in South Sudan, run by Mott MacDonald, Cambridge Education. And the program reached 2.6 million girls, because it's the Girls Education South Sudan program. So the emphasis was on girls. But in the second phase of the project, starting in 2019, the program was it identified during the first stage, which started in 2010, that they really did have to uh, elevate the status of disability in the program. So disability became a cross-cutting issue through all the outputs of the program. And it was massively successful because it was one of the first of these large-scale, national programs reaching all schools in the country, namely like about 4,600 schools. And embed inclusive or disability inclusion as a cross-cutting issue. That in itself was extremely important. And the issues such as behavior change, the capitation grants, cash transfers, quality education, and the whole research leg of the program had components of disability inclusion in it. So for us, it was really interesting, as the advisors, to observe how this project unfolded, how the disability became ever more visible in the program. And one of the main contributing factors was that there was disability data played such an important role, that the growth of the disability data, of which we'll be speaking today, was actually a key component, because we couldn't give the cash transfers. We couldn't hand out the capitation grants if we didn't have enrollment data, and it had to be very well disaggregated. So we'll be talking today to show you, how this has been one of the most enabling factors in the program to not only embed disability in the education system as a key issue and deliverable, but in the program. And I think what we hope to share with you today is how programs of similar nature could go about lifting the importance of disability in the program, so I'm making it a cross-cutting issue rather than a standalone. Back to you then, Dan.
Yes, and is Ms. Esther Akumuachire here? I
I
don't.
hope that they're
I know
just
some people
linking.
are joining on the same computer, so I don't see her name listed. But
Yeah. If we if she's not on yet, I think they're just waiting for her. She'll be joining now. We can skip her, and I can we can go on to
Can we just
I
see
don't
if
know.
Lily is there, Marie? I
Yes,
don't know. I think, but I don't know if she's on. But if you are there, are you able to speak?
Lily or Lily Rico. They all ready. I don't know why they're not on. But we can let them speak a bit later, Dan. Um, and they can. Oh, Mr. Girr is here, so I can introduce Mr. Girr, who's the director of EMIS, Dan, if you want.
yeah, why don't you, since you know who's there, why don't you just
Okay,
take over and introduce
okay,
people as they come along?
okay. So we're very happy that Mr. Girr Mabior is on the call. As I say, he's the director for EMIS and very instrumental in this whole program. And I think I'd like to ask him to introduce to us how issues such as data accuracy and misuse were initial concerns for us in the program, and what initial challenges we experienced, and then how did the ministry respond, and then secondly also to give us some idea of the challenges faced at school level to gather accurate data, and what would be your recommendations for improving collection processes. Mr. Girr, over to you. I wonder if he's unmuted. Can you add him as a panelist then? Perhaps he doesn't know how to unmute if he's not a panelist.
I have already
Oh, all right.
put it as a panelist.
But he's not under panelists. Girr, Giir.
There's the notification.
Girr, yeah.
Yeah, please unmute yourself, Girr.
Okay. Yeah, thank you. Can you hear me now?
Yes, very well.
Yes, good afternoon from South Sudan. Good morning in New York or elsewhere where it is morning. In South Sudan, we had issues of data in inconsistencies. The issues that we had experienced in the beginning were concerning data inconsistencies due to teachers collecting wrong data. Let me generate the information that I had made. Just give me 1 minute. Okay. Hello, can you hear me now?
Yes.
Yeah.
Okay, yeah. The inconsistencies in the data that were being produced were a result of poor record keepings at school level, issues of dropouts, because children drop out, they come to schools in the middle of the, in the beginning of the year, and then in the middle, they drop out. So when the team goes and collect the data, it's showing different data. So these were the issues that results to the concerns that we had in terms of accuracy. Also, teachers had issues of understanding the purpose of the data, especially the data for the disability being collected. They didn't understand what it means, what the purpose was, because they did not see anything coming to the schools as a support for the learners with disability right from the beginning. Time taken when using paper-based. In the beginning, we were using paper-based data collection tool, and it was taking a lot of time to collect the data. There were also lack of awareness from the community regarding the inclusion of the disability policy. So some parents or community members did not take it serious to take their children to the school. So that also results to low data being available at the school level, because there were very few learners with disability being registered in the schools. So the Ministry of Education plus partners, they did a lot of things in order to improve these issues. One of the things that they did was they started printing admission and attendance registers, and they were being distributed to the schools. They also started using electronic data collection, so that data is it doesn't take long time to be available for people to use. We also embark on training the teachers on how to fill the questionnaires, and then awareness creation was also created through back to learning campaigns, education forums like ETMC education, transfer monitoring committee meetings, general education, annual review meetings, and radio talk shows. So all those education forums and awareness creation forums were being initiated in order to improve the issues that were being seen regarding the data. So that's briefly what I can say about your question.
Thank you very much. It's excellent to have a bird's eye view from your perspective in the ministry, because of the challenges that you face in the country, being such a wide scope. So I might just tell participants that in the last 5 years, a major progress has been made in the field of inclusive education. The country not only passed their first policy on inclusive education in 2022, it also managed to draft a magnificent implementation strategy for inclusive education from 2026 to 2030. And they now have in the ministry a technical working group on which Mr. Girr is leading the whole data discussion stream on developing actions and targets and indicators for implementing inclusive education. And of course, South Sudan was the latest country to also ratify the convention early in 2024. So I think all of these factors contributed to just a general growth in awareness within government, but also at school and community level about disability and the importance. And I think later on when DG Esther, the Deputy Director General, joins us, she'll be telling us more about this huge growth in attention. I'm going to now go back to two technical speakers and introduce my colleague Rachel Gondwe. While she's starting to share her screen, I'll just introduce her. She's been working very closely with the data team, Anthony Otieno, who will be speaking just after her. and then she worked closely with them on giving the the whole introducing the Washington Group questions into the data system. She's going to tell us all about how that worked and what our experiences were. And then after her, Anthony is going to speak, and I'll go on to introducing him then. So Rachel, what we'd like you to tell us more about is why the Washington Group questions, the short set was selected, and what misconceptions had to be addressed when we started first introducing that in the enrollment. And then secondly, what were the most common challenges we faced? And lastly, what was the experience of how people became aware of the importance of data for planning? So I think I'll hand over to you now.
Thanks very much, Marie. Can you all hear me properly, and can you hear the screen?
Yes, perfectly. Thanks.
Yes, I can hear you.
Thank you. So let me just give you a little bit of introduction then to the disability data in South Sudan. Prior to, so GESS, there was one, the first phase of the program, and then in GESS 2, which came in 2019, that's when disability inclusion was brought on board. And at that point in 2019, we had very little disaggregated enrollment data. There was no specific...
Rachel, sorry, your screen is not moving. I don't know if you're on, we're just still on the opening page.
Well, I don't know why that is.
There it is. There it is. Yeah.
Okay, it's probably just a bit slow.
Yes. Okay.
Yeah, sorry. There was no specific disability screening tool at that time. Most of the data was collected on a paper-based tool, which was called the Pupil Attendance Register, or PAR tool, which was sent round to the schools with a number of disability questions on there, and that it was subjective to the teacher's skills and knowledge about what those questions were asking and how they filled out the form. So there was very little data that came in at that time. There was around about 5,844 children with disabilities enrolled in school. Some of them did have multiple disabilities, bringing the number to around about 6,599 children that we had on the record at that time. So these were very, very low numbers. And there was another system as well, not just the data, but obviously we had the management information system in South Sudan, which was also collecting disability data, but the two tools didn't quite speak to each other. There was a difference in the language, a difference in the way that the disability data was put together. Some of the were inappropriate language. So when we just see the screen, if you see the next screen, I'm moving on now. Can you see that?
Not yet, but it will come. You can go. You must just perhaps click before you get to the end of the screen because it takes a while. Sorry.
Sorry, yeah. I'm calling from Zambia. Our internet connection is not well at the moment. So in 2020, we wanted to introduce the Washington Group questions into the program, onto the pupil attendance register, to try and improve the way that we collected disability disaggregated data. I don't know if you remember at that time in 2020, the report, the Global Education Report, came out as well at that time, which was about inclusion and education, all means all, and they were very much recommending the Washington Group questions as a means of collecting data. And at that time as well, Leonard Cheshire was the consortium partner on disability inclusion, and we had also been using the Washington Group questions in our programs. And so it was felt to bring in the 6 short set questions into the pupil attendance register. So at that time, we then set out to train all of the staff, all of the GESS output across those different output areas that Marie had already mentioned. The state anchor team leaders is what we called them, but they were the project implementers in the different states. And then the other key relevant ministries, such as the Ministry of Gender, Child and Social Welfare, the Ministry of Youth and Sports, Ministry of Health, they were invited to the trainings as well. and the South Sudan Union of Persons with Disabilities. They were all trained online in about a day's training of the importance of the Washington Group questions and how to use the Washington Group questions. We used to develop that training. I will just say that we used a lot of the information that was available on the Washington Disability Statistics website that was developed in partnership with Humanity Inclusion as well, and it was useful information. So in 2021, that was the first year we were able to introduce the Washington Group questions into the pupil attendance register that was rolled out in all 10 states. And so in 2021, we had significant change in the data, as you can see on the screen. Hopefully it's coming.
Yes.
So we've managed to move from 6,000 children with disabilities to 41,000 if we use the some level of difficulty and above cutoff points. So we did do the data, as you can see, we split it between the different cutoff points, but the program decided to use some level of difficulty as its cutoff point. We know that children with disabilities, even if it's some level of difficulty, are going to school and excluded. So, and still face a lot of the discrimination challenges there. We decided to use some level of difficulty. And also in the table below, we are able to disaggregate the data by functional difficulty, streamline all of that. Where we had the confusion before the different terms, we now streamlined that through the functional difficulty names of the short set. We can't say that it was perfect. It was the first time we still had a lot of challenges with data collection. There were a large proportion of the PAA tools that were still missing the Washington questions, the data. We know that the cascade model, we're talking national data here, so the whole country using the Washington Group questions, and we use the cascade model training higher level education supervisors and PIAM education officers to cascade the training down to the school level. So I think not all of the teachers were trained. The tools were disseminated in English. They were not translated into local languages, which obviously would be a challenge. Using paper-based tools, again, is subject to human errors. And there were insufficient data quality checks. So checking that the data from the schools was accurate, and then the paper passed up chain to the program data supervisors that were then got all of the forms and had manually input the data. So it was a process, and you can see that during that process there wasn't sufficient data checks. The thing, we now have this amazing amount of data, but it still wasn't available, visible maybe to the states, the different states of the country, for them to be able to use it. It was all sent. So these were some of the challenges that we then set about through the rest of the program to try and improve on. And a number of adaptations took place over the years. The first, in 2023, we introduced now the digital data process using Kobo Box. We removed the teachers having to fill out the forms. We got data enumerators in that were all trained in the Washington Group questions, and they went to the schools to collect on the digital system. We continue to improve this process, and Anthony's going to talk a lot more about this later, to producing a bespoke digital data collection app platform. We, in that year, also introduced specifically disability champions. People in the state had to do disability inclusion advocacy and work, and they had a much stronger, closer role in terms of monitoring disability data at the state level. We also introduced the Washington Group questions into 2 languages. So classical Arabic was available, I think, from the Washington Group, but we also introduced Juba Arab translations. And then we also had the states being collected on a South Sudan attendance monitoring system, which was able to collect now live data for the first time as well. And in 2025, we continued to review, revise, and the data collection process, the training. Every year we retrained, we refreshed everyone's training, refreshed their use of the data app, And this data now is more visible and available even at state level. So people are able to use the data coming out. So I just want to give you a quick show of kind of change in the data over time. The picture on the left there is a screenshot of the data app that we have developed. And then you're seeing now over time how we've been able to review the data, disability data, each year by male and female, and by the type of schooling, level of schooling, primary, secondary, accelerated learning program, early child development. I think the advanced school program, which was really speeding up the community girls schools, which is CGS. We can see that the data is actually declining over time as well, but we think that is because as the data has got tighter, there's been more quality checks, the data is now digitized. We think now that we're getting much more robust data from the system. And here again, you can show that we can see that the data disaggregated by type of difficulty and by age. So we're getting a wealth of information now that is available and visible at state level. And now last year, 2025, we had 25,000 children with disabilities enrolled in the country. We did have 10 states, if you remember, over time again, the country changed in terms of its administration, and there's 13 listed here. That's with 3 administrative included or added to the administration structure. I hope you can still hear.
Very well, yes. Fine, yeah. Perfect, okay. Yeah.
Okay, so some of the benefits, what have we been able to do then with this data now through the education through GESS? So Marie mentioned at the beginning that there are a number of programs that the project was running, the cash transfer program, so giving additional cash transfers for children that met a certain criteria. So those in upper primary and secondary would receive a cash transfer, incentivize them to stay in school. By learners with disabilities in those classes, verify that they were getting cash transfer. But also, as in candidate classes, those classes were given a slightly higher amount of cash transfer. So it's again sure that the children with learners with disabilities in those classes also received cash transfer. And then in the research that we did and the advocacy we were doing within the program, within the country, in 2024, we were able to extend the cash transfer not just to girls, but to boys in those specific classes as well. So that was an amazing achievement, I think, in the country. Then capitation grants was a specific amount of money that was given to schools to help in their sort of physical infrastructure and those kind of adaptations, again, if they met a certain criteria. And we used to collect that on expended in terms of expenditure, it was training, it was equipment, whether it was etc. And we were able, through different coding, to be able to identify which proportions of that money went towards disability inclusion activities as well, which is really important information. And we had a number of committees established at state level, which was also talking about this from a kind of more of a state level, where the money was going. There were in committees where the money was going, how it was being spent. So that was another avenue for us to do more advocacy work. And then on a higher sort of national level, again, the inclusive education policy and the implementation strategy that Marie mentioned, they use the data to inform the financial planning and resourcing of the education sector plans. And the Inclusive Education Directorate as well was used the data to inform their work and able to influence. There's another working group within South Sudan which is looking at data across different sectors, and it would obviously be then included in that work that's going on. I've talked about the examination classes, so we're able now to work with the National Exams Council as well to help them identify disabilities in the classes so that they could make assessments on the kinds of accommodations needed for those children to sit their exams. And then another big piece of work that we were working on with the Inclusive Education Technical Working Group, and we had to work closely with other ministries. So the Ministry of Gender, Child and Social Welfare is actually responsible for disabilities. And so we worked closely with them to use the data to inform, initiate a referral process for children enrolled in schools, support services. Obviously, South Sudan, rehab services and some of the supports is quite scarce. So we did a complete sort of mapping of what services are available across the country. And then using this reforms, which included the Washington Group questions, we were able to signpost and refer to these different support services so that they got the support that they needed. Thank you. That is all I wanted to show. I didn't talk.
Oh, she's dropped. I'm sorry. Just made it. It looks as if their data is fragile. I think that was very informative. I might just mention something. Really kudos to the Center for Inclusive Policy. Because what we'd just like to highlight is how we used your videos and materials that you so generously shared on your website for all our training in South Sudan. I think they were really useful, those videos, because they are so clear. We also used them, your videos on the extra cost of disability very well, because that persuaded the government to give more money to children with disabilities and to also extend the cash transfers to boys with disabilities. So that was quite, I mean, I think you played a role without you even knowing it. So thank you, and thank you to Rachel for clarifying this whole trajectory. I'm going to now hand over to Tony. I see that the other colleagues are in the room, but I think for continuity's sake, I'm just going to ask Anthony Otieno, who is the lead for data within the program, to tell us a bit more and give us more further insight in this journey from a technical perspective. And to tell us, Anthony, you can start sharing your screen while I'm introducing you. If he could tell us to the journey that they went through from where they started in 2019, how in terms of collecting data and transcribing that onto the systems and the platforms, and how they went about building the platform and the stakeholder engagements that they had to undergo and technical processes to get to where they are now. And then also show us and give us a short demo of the mobile app and the SAMS dashboard, which you're going to be very excited to see. This was a major breakthrough. I can also perhaps just mention that South Sudan has Starlink, so they do prolific, we all did training through cell phone technology, reaching the furthest corners of a very difficult terrain in that country. And then lastly, I'd like Anthony to tell us more about the integration of SAMS into the EMIS system of government. Over to you, Anthony. Thanks.
Thanks, Marie, and thanks, Daniel, for the invitation to share our experiences when it comes to the Washington Group of Questions. I think as Rachel has ably mentioned in a presentation, there was a journey that we had to go through in order for us to be able to reach where we are now. Definitely, when we started the second phase of the GESS program, we had a bit of disability data, but it had not been fully disaggregated from a Washington Group of Questions perspective. So from a technical perspective, we had a tool back then that could be able to just pick or basically pick a bit of data, but that specific data was being tagged as special needs. It was not fully disaggregated into the 6 areas of the watchdog group of questions. So between 2019 and 2021, of course, we looked at the requirements, and definitely after a lot of training, we were able to understand what the requirements were, and we're able to now translate those business requirements into technical requirements, and that's where we started including it in the old tool that we had for collecting data. In 2023, by the time we reached 2023, we already had already included all the 6 watchdog group of questions within the tool. However, when we started off in 2021, we were using a different form of tagging where we were using A, B, C, and D, but we came and changed it to 1, 2, 3, and 4 to be able to denote the different levels from no difficulty, some difficulty, a lot of difficulty, and cannot see at all. And we were able to do this in order to make sure that the analysis of the data was being done in a much better format. So in 2023, of course, we tried utilizing another tool called Kobo Collect, and we tried testing it out. With the digital transition roadmap in mind of being able to have a new platform, which was basically going to also be integrated within the education system of South Sudan, which is now the EMIS. And one of the most important parts that I'd like to mention here is that we worked really closely with the ministry and a number of stakeholders, including donors and implementing partners, just to ensure that there was common understanding in terms of the different terminologies that are being used for this particular process. In 2024, that's when late 2023, we started developing the mobile app portion of the system. What you're seeing on the screen is the web app portion of the system. So we have 2 portions. One is a mobile app, which is primarily used for collecting data from the field. And then we also have the web app, which is now the dashboard that you're able to see here. And I will explain why you're able to see the logo of EMIS on the left, and why we are basically having this specific application being hosted within the EMIS system, which is a government system in South Sudan. In 2024, that's the time now we started, we had already developed the module for enrollment. The module for the enrollment included all the fields that you're able to see here. This is a module that was now going to capture the learner details. The same information you're able to see on the screen is the same information that the same features that we have on the mobile app. Particularly when you come to learners with disability information, we were able to disaggregate that particular information into the 6 Washington group of questions for every learner. So within our system, we have captured more than 2 million learners' details to know whether that learner has a disability or not. And if the learner has a functional difficulty, then what is the level of functional difficulty that that specific learner has, and we're able to get that information. The same thing that we've done with teachers, of course, also for teacher information. If you look on the right-hand side of your screen, you're able to see that we're also capturing the disability information or functional difficulties for teachers. So we also know how many teachers have a functional difficulty in one of the areas. This particular information also gives the ministry the ability to be able to plan and to be able to see how resourcing could be done in relation to supporting inclusive education and also in supporting the teachers who have got a functional difficulty. Now, when we look at what we have here, this is just the dashboard side of things. I have requested me to be added I made a request. I have another account that has the mobile application, which I just wanted to quickly run through, because one of the most interesting features of the mobile application is that that specific application can be able to work offline, which implies that because of the connectivity challenges that South Sudan encounters, there are areas where there's no internet access. There are areas where there's no phone access. There are areas where the connectivity challenges are there. And therefore, within the mobile app, one of the things that we designed was an offline fast mobile app, which implies, provided you have already downloaded some module from the system, then whenever you're going to be in the field, regardless of whether there's connectivity or not, you will still be able to collect that information. And then after collecting that information, you'll be able to synchronize that data into the system. That has been a very, very huge milestone in that we were able to also reach remote areas that did not have any form of connectivity. The implication of that is that the turnaround time for getting data from the field had been reduced up to a minimum of just 48 hours, 24 to 48 hours, which implies that if somebody was in a remote location and collected data in the morning, and when they went to a place in the evening where there was connectivity, they were actually able to synchronize that specific data onto the system. Same thing happens whenever we speak about data. Of course, data basically helps the ministry to make adequate plans. And in making adequate plans, one of the things we also looked at was basically getting reports. And getting reports, we had mentioned that we needed to have tailored reports by being able to disaggregate these data by class level, being able to disaggregate the data by gender, being able to disaggregate the data by the type of disability and the level of difficulty. So we also have a dashboard where when the data comes in, we're able to know how many learners have got a disability in primary one, for example. How many learners have a disability in ECD, for example. How many learners have a disability in senior one or senior two or senior three. This in itself also gives us that liberty or that particular leeway to be able to know where a certain intervention is required within the system itself. Same thing happens, maybe lastly, before I move on to the mobile app. Whenever you go to the main page or to the landing page, this landing page is a page that is accessible to anyone, which implies you do not really require to have any sort of credentials to access this page. It's a publicly accessible page. The only modules that you might not be able to access are these other modules that are related to the school's enrollment, attendance, grants, census, reports, and city reports. But the dashboard itself, this is a publicly accessible dashboard, and you can always be able to come and change the academic year to be able to check what specific data you are interested in. Whenever we are looking at the main dashboard, there's a general overview. This is just some statistics from last year, where you can be able to see the distribution or the data in relation to enrollment. And then just on the left-hand side here, you're able to see the percentage enrollment with respect to learners with difficulties or learners with disabilities. Then, of course, when you come to the Learners tab, you're also able to see how many learners with disability are there, and it's basically disaggregated by state. Whenever somebody is interested in more detailed information, that detailed information can always be gotten from the reports section here, which I've just mentioned, and that information is only available to persons who have been given credentials to access the system. One of the most important things is that we are aligned to the GDPR compliance rules on data protection and privacy. And therefore, there's some information which only authorized personnel can be able to access. But the general data in terms of the aggregate information can still be accessed by different people. Allow me to share my other screen. Just give me 1 minute. So what you're seeing on the dashboard, this particular dashboard is as a result of what was actually collected. Okay, let me send a request to be accessed, to be allowed to do that. So what you're seeing here, this is the end product of a process that starts from the mobile app. So allow me to share the mobile app. Just 1 minute. And let me know whether you can be able to see the mobile app.
We see it.
We can see it now.
Oh, great. So I think I'll just mention a number of put a number of quick highlights on this. The first quick highlight is that all the learners are enrolled using the enroll module. And the enroll module is basically a module that allows the different states to enroll all the learners. So for every learner that is there, the details in relation to the 6 areas of the Washington group of questions are normally picked up by the system. So the system is able to do that. I've just put a number of fake students. So here, this is just the interface of the mobile app. And remember, one of the things I mentioned is that this particular mobile app works on offline mode also. If I was to come and switch off the internet here, then you can still be able to basically collect data from the field. I just want to focus on this particular area here. One of the things that we just want to mention is that by default, the value that all these 6 areas have on the system is 1, and 1 stands for. Can anyone guess what 1 stands for? No difficulty, right? So we talk about the different levels. No difficulty. So if I was to say that I'm registering a new student and I want to say that this student has a difficulty in, let's say, seeing, I'll be able to click there. Then I have no difficulty, which is the first level. And I have a number of shields here, 1, 2, 3, and 4 shields. And I know that once I've been able to determine the difficulty level of that particular learner, I'll be able to come and choose the specific shield that now aligns with that one. So I've chosen the second one. It's actually picked very fast. And it shows that this learner has a difficulty in seeing, and also the level of difficulty is level 2, which is some difficulty. It is important that once this enrollment has been done, one of the things that we did realize was that after the enrollment process was completed, we wanted to go back again and do a verification process of the learners who had been onboarded or enrolled as having difficulties or disabilities. And therefore, we came up with another module. And this particular module was only filtering learners who had initially been onboarded as having a difficulty. And therefore, this verification process was just a process to go and recheck again whether these learners have actually a difficulty. If we're able to see this specific area and this specific school, you'll be able to see how many learners with difficulty were identified. And then also per every school, you'll be able to see the total number even before you enter that specific school. If let's say we went to a BA Boys, we know that in a BA Boys now here it shows we have 2 learners with difficulty. And when you click on that one, it asks us to verify. So we come here and verify. That means that you're already in the ground. And I've just included just 2 names here for learners for this particular demo. So when I'm in this particular school, I'm able to see that there were 2 learners who were onboarded earlier in the year who are who are enrolled or onboarded earlier in the academic year. And I just come here and check the details of this specific learner. I'll check and make sure that the information is correct. And if by any chance I find that this learner had no difficulty. So for example, here it shows that this learner had a lot of difficulty when it comes to hearing. Okay. Let's move this one here. This learner had a lot of difficulty when it comes to hearing. But maybe at that particular point, we also discovered that this learner had another sort of difficulty in recalling, for example, or in seeing. I could come and edit the details before I verify. I could come and edit the details. It brings me back to this specific page here, or this specific screen. And what is basically happening is that that information is being pulled from the server. If I was offline, then it implies that that information would be pulled from my phone or from the local storage of your phone. And therefore, once that information comes to your phone, you're able to come and say, oh, this learner had a difficulty in seeing, which was not captured. You come and click on it. Then you're asked, what is the level of difficulty? Let's say you had a lot of difficulty, which you choose the third one, and automatically it picks. And then you just come and click on update, and that information is updated. So I don't want to do the update now because this information will be updated into the system as we speak, but I can still be able to now change it later on. When I click on update, that information goes and is updated automatically in the system. So I think when we look at the entire workflow that we basically developed, we developed a workflow that was meant to ensure that once a particular process occurred, then we could be able to counter-check that particular process within the system or within the dashboard to see whether those learners actually have been onboarded. I think the last one that I'd like just to mention is that Marie and Rachel had mentioned something on cash transfers and capitation grants. I'll just mention them in passing. When it comes to cash transfers, now we are able to track how many learners with disability have been paid a cash transfer. That means that in terms of ensuring that all these learners are facilitated to go to school, the cash transfers that are being paid or were being paid to girls before now has also included boys who have got a disability, which is very, very key. When it also comes to capitation grants, which I'm just mentioning again, when it comes to capitation grants, it's important to note that in capitation grants, now we are able to now track how many schools or which specific school has basically submitted a budget. And there's a component of disability that has been captured within that particular budget. So allow me about 2 more minutes to just switch back to the other screen. Then I can just be able to show you something related to capitation grants and what we have done within the system so as to ensure that whenever the ministry will now be budgeting, there will be an inclusive sort of a budget that is also considered within that particular process. Give me a minute again, I switch.
While you're switching, there's a question in the chat about whether you can capture multiple disabilities, whether it's easy for you on the system to pull out learners with multiple areas of difficulty, and whether
Yes,
yeah.
Yes, we have that capability of capturing multiple disabilities. If we go back to that specific example, or if I could just maybe also show you on the web, on the mobile app, it is possible. On the web, it's also equally possible. Just give me a minute. I share my screen again. Are you able to see my screen on the web?
We can see, yes.
Okay, great. So just a quick example, just to answer that question. So if I was to add a new learner, I'll put the learner details and the other features or the other indicators for that particular learner. Then I will come and I find out from this learner, is there a difficulty in seeing? Maybe they say yes, we pick 2. Is there difficulty in hearing? Maybe 3. Is there difficulty in talking? Maybe no difficulty. Self-care, maybe it was 4. Walking, maybe no difficulty. And recalling, maybe some difficulty. In this particular instance, what we have simply done is that for this specific learner, we have captured multiple difficulties or multiple disabilities within this particular learner. So the system has been made in such a way that for every learner, you can capture either one or multiple difficulties within the system.
Yeah. Okay. Are you finished, Anthony?
Just
I think. Oh, you
one,
wanted to show about capitation grants. Yes.
yes, just 1 million in capitation grants. There's a lot.
We'll answer your question, and just now, I see we are picking up the questions in the chat.
Okay.
I think not more than 1 or 2 minutes, because I still want the government people to speak, Ben and so on, Anthony.
Yes, yes. That's why I just went directly to the demo. Just 1 minute. I will just pick one, maybe just one budget. So here you can be able to see just within the budget. I'll not maybe go into a lot of things, but within the budget itself, there's already a provision for learners with disability, or a budgeting that needs to be done for disability. So when budgeting is being done, there are a number of options that could be chosen. And of course, we have put about 3 important codes. E1DI. E1DI means that's a code for physical inputs. DI means disability inclusion. Then another category is E2. E2 stands for learning materials. And that particular code basically deals with learning materials that are bought for specifically to assist learners with disability. And then E3, DI is just focused on providing general support for that particular school. I'd like to stop there and hand it over back to you, Rachel. Thank you.
Yeah, thanks, Anthony. That was really interesting. I think phenomenal, the innovation that was brought about by this. And perhaps I can just answer Anne Hayes' question about the finer grained impairments that she's mentioning, like dyslexia and so on. We did very strongly emphasize that this is just enrollment, capturing children at enrollment. We do acknowledge that this is not an assessment tool. It is that's why we started this, to kickstart the whole process of a referral pathway that Rachel was talking about, so that there are further systems put in place. The country is rolling out it. We're starting from really ground zero in South Sudan in terms of systems and availability of services. So once we have this data at our fingertips, initial data, we can start a referral pathway. We can create a demand for assessment centers. So the country is rolling out an assessment and resource center for each state, and later on down to every county and Payam level, but it's far from there yet. But what we've now achieved, when we started out, we didn't even pick up intellectual disability, let alone issues such as dyslexia and other more complex disabilities. And to have moved this far in 5 years has really brought things to the fore for the government to show how they can actually start identifying learners. And we also established at schools school-based support teams who would take this data and problem solve around the data on how at the school level they can already start using the capitation grant to improve conditions for children with disabilities at the school. So I am now going to hand over to our last speaker. I'm not sure DG Esther Akumu has joined us because she's out in the field, and I wasn't sure whether she has internet. I'm going to ask my colleague Lily Ricosino to come on, unmute herself, and then perhaps I can ask Mr. Ben Low Poggo, who's the Director for Inclusive Education at the Ministry of Gender, General Education and Instruction, to give us a kind of a wrap-up of how this data, availability of disaggregated data in disability, when I will never forget the first day, the aha moment we experienced when all this data came onto the screen and planners and government officials could actually see how many children have low vision and how many are totally blind and where they are. The possibilities this opened for government to plan. So I'm going to ask Ben, can you tell me, our audience, how this data lifted, supported policy credibility and political buy-in for the inclusive education agenda in South Sudan, and then also change the way in which inclusive education is seen by stakeholders in South Sudan? Ben, we're very happy to have you here. Ben has been such a leading voice in that country to open doors for people with disabilities. Over to you, Ben.
Thank you very much, Marie. I really appreciate the effort you and your team has taken to support us in South Sudan to establish the data collection system. In the first place, I also want to appreciate the Center for Inclusive Policy for developing interest to hear from us from South Sudan. I think this is going to be something great for us when we work together for the good of learners with disabilities in this country and probably in other countries as well, because this inclusion is very important. As some of you know, I'm visually impaired, but then the inclusion gives us the opportunity to learn together with other children, and that's why it is one of the most important systems that we need to expand across South Sudan and elsewhere. Indeed, it was quite a challenge for us in the Ministry of General Education because previously this data was not there. What my colleague Girr had said was actually that they started with assessing those learners with disabilities whose disability was visible, but there were many other children with invisible disability that could not be revealed because of the previous tool that was used for collecting data. I'm also happy that Mr. Girr mentioned that they moved forward towards ensuring that the new tool for assessing, for collecting data on disability is now very much improved. And I believe we will continue to improve this for the good of our children with disabilities. Actually, due to lack of adequate knowledge on the number of learners with disabilities in the country previously, the attitude of people towards learners, education of learners with disabilities was not very prevalent. I mean, it was more negative. People didn't want to have these children enrolled, and that was very unfortunate. However, with the involvement of the Washington group questions and the data that appeared, that has been provided for the leaders to see and to know that there are many, many children with disabilities who need to be paid attention to, then we are saying that this system of collecting data for our children with disabilities is very, very important, because we know that now the ministry and even the public has come to know that it is important to ensure that all learners with and without disabilities need to go to school. And it is from this data that has been collected, which has included the Washington group questions, that has shaped the attitude and the responsibility of government officials to see that we strengthen this system of education for everybody else, so that nobody is left behind in schools in South Sudan. So this system is very important for us. I can see how Marie and Rachel and Anthony have really made it workable for us. I think this system will help us a lot. It is informing us that we need to plan, and the best way to plan is to have this kind of data collection, which provides us with the information for which we can plan, we can monitor and evaluate the education of learners with disabilities in this country. So I can see that when this system is well strengthened, of course, we are at the grassroots level at the moment. Of course, we have moved a little bit further, but we need a lot of capacity building, which I think I'm very proud of, because the people who are working with us to support us lay down this system are very effective, very experienced persons. And I believe they will strengthen us in South Sudan, and we shall see a situation where learners with disabilities will not be left behind. They will be included in the system of education, and therefore they will benefit from the education system, from the data collection system. I know that, for example, with the information that is provided for through this system, we are able to determine. I have actually been very, very proud of the team, because when you click on a state, you will be shown the schools that are there. You click on a particular school, and they will tell us the number of learners with disabilities, disaggregated, so that when planning to provide materials for them, you would be able to determine, yes, we have this number of those learners with visual impairment who may need braille, they need this kind of print. This is very helpful for those learners who will really benefit from this. And therefore, this system is very, very useful, and our government has already bought into this, idea of this concept of inclusive education, because across South Sudan, we have gone to different states explaining what it means to have data, especially based on learners with disabilities. And the reception is good. Our high-ranking officials in the ministry are very receptive. So I believe that with this kind of system in place, we can see the future of this nation being shaped, including ensuring that persons with disabilities, learners with disabilities, are in the process of getting education in this country. I think this is what I can say for now. Thank you.
Thank you. So Ben is someone who is now picking the fruits of many years of fighting his own battles as a school child right through school in South Sudan until he completed his master's at Syracuse University. So he is such a role model just in himself. I think I'm going to hand back to Dan. If there's anyone of the team who felt that we didn't do justice, there's something else they'd like to contribute, Lily, you can do it during this upcoming discussion. Over to you, Daniel. Thanks.
Well, first, thank you all for coming, and it's very impressive to go from almost nothing to such a developed system. And it's also quite, we always talk about how we need data in order for there to be action. And it's great to see not only the data is being collected, but it's actually being used and having an impact on students' lives. I have one comment to make, and then I'm going to read Polly's question. We were putting up those charts with all those numbers, and I was busy trying to divide them in my head to get percentages. And what was very clear, was that the rate of disability and the distribution by disability types was very different from state to state. And I was wondering, in your opinion, if you think that's because of actual differences in how disability is distributed across the country, or whether it's a difference in the accessibility or the environment within those different states that leads to different types and levels of barriers. So that's my first question. And then I'm going to read Polly's question, and then if people could come in. Polly said she was wondering about the situation of children with albinism. Her understanding is that children with albinism will not always be identified through the short set, unless they have problems seeing. Moreover, there might be some security issues around collecting detailed data on children with albinism, yet they would be very relevant constituency for the policy measures mentioned, including cash transfers and onward referrals to support services. So I wonder how that issue, how those children are being dealt with. So if you could, those are the two questions. If anybody would like to address those.
I think our colleagues in South Sudan are well positioned to tell you about the distribution and albinism, what we've done for albinism. Perhaps just a wee little input from myself. Juba, Central Equatoria State, is where the capital is. And traditionally, that was where the only centers of support for disability were situated. There are no real, you can't really talk about special schools in South Sudan, but they did have a school for the blind and a school for deaf in Juba. And there's also the Uzra Tuna Assessment Center. So it was just our perception has been that many families sent their children to Juba because they felt they would get better help there. That's the one thing. But I think Lily, our in-country disability inclusion lead, has engaged at every state level and can tell you much more about why would there be lower incidence in some states rather than, in comparison with other states. Lily, you can unmute and then speak.
Yeah, I can also say something about the distribution. Yes. One of the issues that cause the vary in distributions is the population in each state is not the same the other. So different states have different populations. Some states are even administrative areas where carved out of either 2 counties or 1 county, and that the population is very, very small. So that also contributes to the small numbers that you see there. Another factor is what I said earlier, that community awareness on the inclusion policy of taking learners with disability to schools is still an issue that the community is facing, and the government also need to work hard to make sure that they understand that it is a policy of the Republic of South Sudan to take learners with a disability to the schools. So that is the second factor. Another factor is families also see the factor when they take their children to schools, and they don't see the learning going on. Like most of the teachers are not trained on the sign language. Most of the teachers are not trained on how to teach other children that require support in the classroom. So that becomes meaningless for them, and they resort to keeping their children at home instead of taking them to schools, because they don't see any progress. Materials also that are required for the learners to learn, especially learners that cannot see at all. They require braces, and that is not available in many schools, except the schools for the blind in Juba, where you can see children using braces in order for them to learn. So many factors contribute to the low number of learners with disability that are available in the schools. That's what I can say. For albinism, when you look at the Washington group questions, sometimes it becomes very difficult to fit some categories of disability. Even myself, I may not know how I can place a person with albinism in those set of questions. Another category also is a person with a hunchback in South Sudan is considered to be a person with disability. But to place him or her in the categories becomes very difficult when you apply Washington group questions. That's what I can say. Maybe another thing that I like to add also, if you have enough time, is on the question that was said to me. I have not responded to all the questions, but there was one. There's one that I need to say something about. It says, reflect on what you do differently, given the stage where we are in South Sudan now. We would like to strengthen the data system integration. We have started now moving census data and SAMS data into one platform. We need to move all other data sets into one platform in order to have a centralized data systems that will make it easier to manage and also to finance and to control the information. We would like also to decentralize the data collection processes and some analytic processes, so that states take the responsibility of collecting data, and the national ministry takes the responsibility of verification, because monitoring and verification mechanism need to be very much strengthened in order to ensure data quality. Another thing is we will need to continue with teacher training, given the attrition of transfer of teachers, especially head teachers. When a head teacher is transferred from one location to the other, the skills that were given go with the teacher, and you get a new teacher that does not have skills on how to keep education records, and the skills on how to fill the form, the questionnaire. So we will continue to strengthen these lines so that we improve our data collection. process. That's what I need to add. If I have more time, I can also.
Right.
Thank you.
I can say that the Washington Group short set they're an important set of questions, and they're a great first start. But as we said, the reason why the child functioning module was developed was because children with developmental disabilities are identified there. And if you're talking about intake, the teachers don't know the children well enough on that first day to answer some of those child functioning module questions too. So where in the process you're asking the questions for what purpose depends on which questions you ask. And if there's something like albinism, or in some places facial disfigurement, or other things which are not picked up by the Washington Group questions, but are important for policy reasons within the context of which a country is operating, then there's no reason not to add those questions if it's politically possible to do so. And but this is like I said, this is a really great start. It's also great to hear about you talking about having a centralized system for interoperability between different data sets. We actually are having a disability policy insight that we're going to be publishing later this year, talking about that harmonization, talking about building a disability data system, moving beyond these separate MS, health, social welfare data, and trying to connect them together. It makes the data much more powerful and useful.
There's still my colleague Lily would like to speak a
Oh,
little
sorry.
bit.
I'm sorry, Lily.
Yes.
Go ahead.
Yeah, thank you very much. Maybe I can just add on the distribution of the different numbers in different states. One of the issue might be the landscape. There are some areas in South Sudan that are very hilly, so it's much difficult for some learners to move from up to down, to access schools, and also the distribution of schools, the number of schools. There are states that have more concentration of schools, whereby the distance become easier for learners with disabilities, and in some areas it's much difficult, which prevents them from going to schools. Unless we have many schools around, then it will be easier for the learners who are having difficulties to access those schools. About the albinism, most of the learners with albinism are associated with difficulty in sight. So mostly we capture them as learners with difficulty in seeing, some level of difficulty in seeing and so on. But then we have these activities that we had in one of our program activity, the mentoring clubs, where we use that clubs for the anti-bullying, for the learners with albinism to feel safer and to attend classes. They need to be friendly to other learners. Yeah.
Thank you. Thank you. And it's collecting data like you're collecting, which helps us show those things and so that you can actually move on them. So thanks again. I don't know if
I know can I just say one thing, Dan?
I was just about to say, do you have any last comments, Marie?
Oh, sorry. Yeah, sorry. I don't want to speak too much. It's just that I think we got very far to get people to move away from medical diagnostic categories in South Sudan. You can hear the language that everyone is speaking about difficulties. It's much more important for them to understand what is the difficulty to be addressed. So in my own country in South Africa, I'm appalled to see how children with albinism get placed into a school for the blind, not because they have a visual impairment, just because they have albinism and they feel safer there. Fortunately, we can skip that kind of a thing in South Sudan, because people look at the difficulties, they start really engaging how can they intervene and help a child in a practical way. And that data that we now have gives a country in broad strokes the ability to plan at scale, to know where to send wheelchairs or mobility devices, because we're not at the level of even refreshable braille or electronic devices, so if you start right and you get people out of the medical model kind of thinking, I think you have a better trajectory going forward than where we are in the countries of the north or more developed countries with more resources, where we start with all this diagnosis and then that becomes a segregatory aspect, and that adds to Anne's concern about the assessment centers. I think it's very critical for all the countries introducing assessment centers that they don't take the children away and segregate them through the diagnosis, and rather give feedback to the school on how to practically support the children in school. And I think those are the first steps that we've been able to make breakthroughs in South Sudan. Yeah.
That's great. That's great to hear. Yeah, and I'm totally on board with everything you just said. So thanks everybody. I think this brings us to the end of the seminar. So thanks for all our guests who came, and thanks especially for those of you who presented the work that's going on in South Sudan. It's inspiring, and look forward to seeing it moving forward even further. So thanks everyone.
Thank you, Dan.
And
Thanks
take
for the
care.
opportunity. Thanks.